how often should I get PRP and exosomes? This is a question that comes up a lot, and it's really kind of a soft spot in science. PRP studies have shown, they think 3 sessions or more are where you start to see and yield that benefit. In my practice, when we've looked at trichoscopy, I think it's probably closer to 5 treatments, maybe more for men. Exosomes. I think in our practice, we see that a lot of our patients will see a benefit with 1 treatment, but most need maybe 3, sometimes 4. So the question is, how many treatments do I need? Does this last forever? How often should I get this done? So I think if you're thinking about PRP, this should definitely be a much more often than you think type of thing. The best results for PRP are often going to be in combination with some sort of pharmacological therapy. And I think Nutrafol and or finasteride if you're a post-childbearing male. I say childbearing, meaning you're not going to bear the children, but you're done having kids. Maybe I should say procreating male. So that being said, PRP I think ends up being one of those things that ideally you do monthly, every month, and that should be either 3 times to infinity if you're looking at that as your standard treatment of growing hair. Exosomes, I think you can space that out a little bit more. I think if you're thinking of doing a series of 3, I probably would do them kind of every month for a series of 3. Some of our patients who do these things called mini exosomes, they do them basically on regularity, some do it every 2 weeks, some do every month. It's much more cost effective, and the results you see with that frequency and regularity, it's pretty phenomenal because you're getting constant signals to your head to regrow hair. And I think exosomes, as I said in previous podcasts, is much more powerful than PRP. So how often should you get it? I think if you're thinking of starting out with exosomes, maybe 3 times a year seems reasonable if you're doing full exosomes. I do think you need to maintain this every year. It's not something you could do and all of a sudden your hairs at some point are going to lose that signal. They're going to lose that drive to kind of keep themselves alive. So you're going to want to kind of constantly maintain this, but you can space this out. I think 3 times a year would be the minimum I would suggest, but it's a good way to stimulate your hair, and one way that I think actually does work.